Hi, welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz. Today, we're going to be focusing on ADHD in women. We're going to be getting into some best practices as well as innovative natural solutions with Dr. Lauren Noel. A little bit about Dr. Lauren Noel. She's a licensed naturopathic doctor, also called Dr. Lowe. She's an expert in natural medicine and received her doctorate from National College of Natural Medicine in Portland, Oregon. Since 2010, she's treated over 5,000 patients using natural therapies. That is quite incredible. I met Dr. Lauren in 2013, and I'm just amazed at how her growth as a person and as a practitioner that I've seen in her. These days, her areas of expertise include natural fertility, thyroid hormonal health, digestive disorders, and autoimmune conditions. She's a frequent lecturer on health radio shows, medical conferences, and is the host of the Dr. Low Show, a top rated podcast on iTunes that has attracted over 4 million downloads. That's amazing. I think I've been a guest a couple of times and I always really enjoy it. Dr. Noel owns Shine Natural Medicine, a virtual medicine practice that offers naturopathic medicine and nutrition coaching to patients all around the country. She's the most active on Instagram, and you can find her there. And her practice is Shine Natural Medicine. She resides in San Diego with her husband and their 5 children. And she also has another one on the way. Congratulations, Dr. Lowe. It's so great to have you here. It's always so great to connect with you and hear about the latest fascinating things that you've been doing with helping people through natural medicine and functional medicine and integrative medicine. I would love for you to share a little bit about how you came to become an expert in ADHD.
Thank you. Thank you for that intro. I would say most of the things that I tend to specialize in are things that I have walked through, things that I have experienced personally. And as we'll get into, most women who are diagnosed with ADHD, it's after some sort of event or life stage that really illuminates the severity of these symptoms. Because we tend to be really good at masking these symptoms until we can't anymore. So that's what happened for me. I had I have 4 bonus kids, but I myself personally birthed one and I have one on the way. So my son, he's almost 6. So I had him when I was 38. And after that, my symptoms just really started to worsen a lot. And then I was like, do I have bipolar disorder? Like, what is going on with me? I just can't get my ish together. And we hear that sentence a lot. I just can't get my together. And I sought out a clinic that I worked with. They did a scan, they did a whole intake, a whole assessment. Because it's not like you take a blood test and officially you have ADHD. It's a whole assessment you have to do, and we can get into. And then I was diagnosed at 40, and it's like the aha moment happened. The light bulb turned on, and my whole life made sense. I mean, I could look back and just see so many different examples of how this showed up for me, and how instead of looking at it through the lens of ADHD and compassion, I looked through it from the lens of shame and what's wrong with me, and just a lot of, and a lot of us with ADHD, we have heard, I think it's 20,000 more pieces of negative feedback by it's like age 17, I believe. We are given so much negative feedback, like you're too sensitive, what's wrong with you? Like if you could just focus, get your stuff together, stop daydreaming, all this stuff, rather than wow, let's really dig into the amazingness of your mind and figure out a way to navigate this in a way that works for you. And so that's how it happened when I was 40. Sometimes when you first get diagnosed, it almost seems like things get worse because you realize it really everywhere, all the ways that this shows up. But over time, you start to find out how it works for you, how to navigate through this for your own personal neurodivergent brain, because you don't have the same brain. Only 5 to 8% of people truly have ADHD. So, some people say it's overdiagnosed. I don't think that's the case. I think it's just finally getting the attention that it deserves. But really, you have a neurodivergent brain in a neurotypical world, and there has to be compassion with that, and just realizing that you're going to operate differently. You're going to walk to the beat of your own drum, and that's beautiful and it's awesome. And a lot of the innovators and inventors and explorers and people who have done so many amazing trailblazing things have ADHD. So yeah, so it's been a journey over the last. I'm now 44, so for the last 4 years of learning about this and seeing how many patients are dealing with this that I didn't know. And I was able to finally help them when doctors didn't have answers. And there's a lot of nuances with ADHD and how it can show up for women that's different than men. So that's how it showed up for me. So I understand what it feels like and I can empathize with anyone dealing with it because it's not easy to have.
Oh, thank you so much for sharing your story. So much that I want to dig into there. So, a lot of times people get diagnosed primarily by symptoms these day and age, but you were actually diagnosed with a brain scan. Can you tell us more about that?
Yeah, so it's not the conventional gold standard for being diagnosed, but I went to the Amen clinic and they did a SPECT scan, and that's basically a CT scan that's kind of fancy that shows blood flow to different regions of the brain. What they found for me was a few things. They found PTSD. There's the centers of the brain that were really lit up, that were the trauma centers, but they also showed very low blood flow to the prefrontal cortex, which is the front of the brain, and that's what does executive function. So I think of that kind of like the boss at the workplace. So my the boss wasn't there, and he probably hadn't been there for years. So everything was just kind of operating in some chaos. But what happens with executive function? It helps you to calm your emotional response. It allows you to have a proper sensory response to sensory input, and just being able to keep things organized and like let's say you have a goal, executive function helps you to put that into steps and timeline and all of that. So that's why with ADHD, it can be harder in order to, you can have this idea, let's do this, let's go change the world. I have this invention, but actually putting it into real time in the real world with steps, with deadlines, all of that's executive function. Um, and so that's what they saw. And then just doing a real thorough history with me, going through how this showed up throughout my life, because if you have ADHD, you've had it since you were young. It's not something that, it's not common to acquire it so much. It's more so something you have when you're young. So it really takes a trained clinician to do that, looking at childhood symptoms, social, school, work, relationship struggles, because it shows up in every nuance of your life. Emotional patterns like chronic overwhelm, self-blame, anxiety, those were things that I had dealt with. And also how hormones can impact the fluctuations with that as well. And then there are certain questionnaires and checklists that can be done, like the ASRS, which is the Adult ADHD Self-Report Scale. There's Connor's Adult ADHD Rating Scales, and there's other ones. Also getting collateral information from family, partners, teachers, how this is impacted, especially like if it's a child, seeing how this has impacted the education space for the person. And then the big thing is ruling out coexisting conditions. There can be overlap. So it's a very large percentage. I think it's 70% of women who have ADHD also have anxiety and 50% depression. So there is an overlap. However, sometimes it's just blamed on that. Like you have just anxiety and you just got to get your stuff together and get on anti-anxiety medication. So they can coexist. And so, yeah, so really it takes a deeper look, especially for women to diagnose this, because it's not the classic, you're bouncing off the walls and causing disruption everywhere you go. It can be more, instead of outer chaos, there's inner chaos. There's that, storm inside where the person looks like they're holding all together, but they might be, chewing the inside of their mouth and they're doing, fidgeting and they're pulling their hair out because they're trying to keep it mask all of these issues, but they have an internal chaos that they're feeling.
I'm really glad that you mentioned coexisting conditions because I think this is very much underappreciated. Sometimes people can have more than one thing going on, right? And we do know with thyroid dysfunction, right? We can have people that have thyroid dysfunction that can be mistaken for ADHD because there's symptoms like inattention, restlessness, emotional dysregulation, that brain fog, right? Sometimes anxiety can occur with that. And you can have, you can have some focus symptoms that are related to thyroid dysfunction, but you can also have thyroid dysfunction and ADHD at the same time. Could you perhaps speak to that like overlap of symptoms in both conditions and how do we parse that out? Like, how do we know, like, oh, you're a hormone expert and a naturopathic doctor. You're so well versed in hypothyroidism and PCOS and all these hormonal challenges. And there's it could be blurry, right? Because there's so much overlap in these symptoms.
100%. That's why doing thorough blood work and really looking at the data is so key. So getting a good TS8, free T3, free T4 antibodies. I'm sure your listeners are familiar with these labs because when you have an underactive thyroid, it with low T3, that's going to slow dopamine production. And that's what it is with ADHD. It's a dopamine deficiency. So that's why there's thrill seeking things, much higher risk of addiction, much higher risk of just thrill seeking behaviors and injuries that can come from that. And just being addicted to your phone, just addictions in general, because that's going to give you that dopamine spike. ADHD folks are way more prone to dealing with that. So if you have low thyroid function, it's going to slow production of dopamine, which is going to worsen your focus, your energy, your memory, all that. And then I'm sure as you have talked about with your listeners, the adrenals are pulled into that as well, right? So when the adrenals are dysfunctional, then that actually shrinks the prefrontal cortex, which is fascinating, and that can worsen impulsivity, focus, emotional regulation. Like I said, the boss has left the building. So when those things are happening, then that's going to worsen the underlying dysfunction with ADHD. So there is an overlap for sure. And this also can relate with thyroid medication. So if someone is on the wrong dosage of medication, like let's say they're on too much thyroid medication, they can seem hyperactive and just, kind of cracked out and all of that. That can sometimes look like ADHD as well. So getting the lab work and doing a real thorough clinical assessment, like, do you have the thyroid symptoms? Like typically you don't get hair loss with ADHD. You don't usually get, cold extremities. You don't typically get constipation, weight gain, that type of stuff. Those can be more so thyroid. And so, really looking at those specific symptoms is a way to just see, okay, is the thyroid involved? Is there a coexisting condition? And then going from there. So, yeah, we don't typically see those physical manifestations as much. Typically with ADHD, you're going to see more so neurocognitive kind of symptoms.
Mm. Thank you so much for sharing that. And I know as you mentioned, with hyperthyroidism, right? So when you're over medicated or you just have a hyperthyroid condition going on, you can be more anxiety prone. You can be more impulsive and restless and agitated, which can overlap with ADHD, of course. But then, you wouldn't necessarily have like palpitations with ADHD. You wouldn't necessarily have diarrhea. Now, I have seen people oftentimes get, misdiagnosed with ADHD or with anxiety or with depression when they actually have a thyroid disorder. And I think it's really, really important to dig into that. And it's not to say that they didn't have these things. Potentially they did, but how much of that was the thyroid causing it? And then, of course, sometimes people will just think they have a thyroid disorder without really going in deeper because you can absolutely have an impact on these other things. We do know L-tyrosine is a precursor to dopamine, which is so important for executive function. And it's also a precursor to thyroid hormones. It's interesting to see where there's an issue with your L-tyrosine levels, perhaps that can contribute to both ADHD and thyroid dysfunction, and you might have both things going on.
100%. And there's so many, my mind explodes. I'm good at patterns and seeing all the connections with things. That's how my brain works. So I think of that. And, oftentimes with women with ADHD, they don't eat consistently, they'll skip meals, and you need tyrosine from protein, right? So if you have a low protein diet, just right there, I mean, that can slow down your thyroid and potentially worsen, ADHD. So nutrition is a big piece of that. But yeah, absolutely with the tyrosine. And that's when we also bring in micronutrients that are needed for that conversion. B6 is a big one, other Bs and minerals and all of that. So yes, there's a big interplay with it all. And when I'm working with patients, you can run in a million different directions, but focusing on the basics, regardless if it's ADHD or thyroid or adrenals, is the first place I start with them because they can get very overwhelmed. It's like I got all these things. What do I do? It's like basics. We still start with basics because, like you said, tyrosine, and that's a perfect example of you need that building block in order to make your thyroid hormone. So yes, that's key.
Yeah, that's really interesting you say about women with ADHD skipping meals. I used to skip meals a lot when I was younger, and I'm curious, potentially maybe that contributed to some of my thyroid dysfunction. Um, I know, you know, typically when I was going through pharmacy school, you kind of have these pictures in your head of a classical patient, right? And when we think attention deficit hyperactivity disorder, I'm picturing this like little boy with freckles and red hair just like, running amok and not being able to sit, not being able to listen, maybe like doing some um, high risk things, getting in trouble at school and with their parents. But and I think there's this myth that ADHD is like this little boy's condition, right? Can we talk about maybe how it presents differently in women and girls compared to men and boys?
What shocks people is that it's the same in terms of the likelihood. So girls have ADHD just as much as boys do. Actually, boys don't have it more than girls do, but they are diagnosed 5 times more because the girls aren't properly assessed, and we don't see it in the way that it presents in girls. So this would be the little girl that's in the class that's maybe daydreaming or doodling, a lot of doodling, kind of in her own world. And maybe the teacher says something that reminds her of something else from a movie or from a song, and she's going into all of that. Oftentimes, those with ADHD are the creatives. So just having a hard time being in the here and the now and being able to focus and pay attention. That's typically what we see from these little girls. And it may show up as anxiety. So like for me, I would chew the inside of my mouth, or I would always be, picking my scalp or pulling my hair or fidgeting. There might be the kid that's always kind of bouncing their knee a little bit, just trying like this internal agitation that you're trying to, self-soothe. It's really stimming. If you heard, it's this common also with autism. Those with ADHD also do stimming as well, and that can look different based on the kid.
Interesting. What about in women? How would it present differently in women compared to men? Do you have some thoughts on that? Because I know a lot of women are getting diagnosed, um, not as children, right? We're getting diagnosed in our 30s and 40s, sometimes 50s.
For women who have ADHD, there's a significantly higher risk of having postpartum depression and postpartum anxiety. So that's a real common way that they finally have that proper diagnosis. Also, when they have their child assessed. So maybe this little girl wasn't the redhead freckle kid bouncing off the walls, but maybe when she became an adult, her child was that. Maybe she had the little boy who was that. And then he's diagnosed, and then she's going, oh my gosh, I actually have dealt with all these issues too. So it can happen through your child oftentimes. But it could be that, you had maybe before you had kids, maybe you were able to function well enough, you figured out how to do it for yourself. But once you had other demands from life put on you, then you just didn't have that ability to sustain it. And then everything just fell apart. Also, hormone fluctuations are a big one. So once a girl goes through puberty and there's the ups and downs of hormones, that's when you can also see a big worsening of ADHD symptoms as well. Because there's a connection between estrogen, histamine, ADHD. There's a big connection there. So there's a higher likelihood of having a histamine intolerance with ADHD, and then that can worsen symptoms. So typically we'll see those things worsen as a woman is going through perimenopause, menopause. Interestingly, for a lot of women, they feel a lot better during pregnancy because they have a beautiful production of hormones. They have the estrogen, the progesterone. There's the interplay with estrogen and serotonin and progesterone and GABA. And there's also a connection with estrogen and dopamine. They kind of have like, sort of a synergy. And so then when that's the case, you feel fantastic. You can keep your stuff together. But as soon as you have your child, you crash and burn. And that happened with my first. And that's how I was able to figure it out.
I can definitely relate to that. I had always been somebody that I guess I would be considered to have very high executive function. I could like plan things and strategic planning was always and follow through all the steps. Like that was always a strength of mine. But then I noticed like during the postpartum symptom, I was like, oh my gosh, like I'm really having trouble with following through on certain things. And I would have a hard time like organizing like when to feed my child and not being not watching TV and getting him dressed and all of these different things. And it would be like noon and I'm still like in pajamas. And I was like, what is happening with me? Now I learned a lot of women do see this as well in the postpartum period, especially if they are breastfeeding, because of that whole interplay with like oxytocin and prolactin, can impact our dopamine receptors. So it can temporarily kind of shut them down. Could we get into that a little bit more for maybe some of the postpartum moms to let them know they're not crazy and give them a little bit of understanding?
Yeah, no, that's a great point with the prolactin piece and breastfeeding. I think it's kind of our way for our body to go, you're not meant to focus, you're meant to just take care of your baby right now. Because when you are breastfeeding and you do have that spike of prolactin, it can have a at, an adverse or a inhibiting effect with dopamine. So it's interesting. And that's why I know before we started recording, we talked about some things that can help balance prolactin and that oftentimes can help with dopamine. But so yeah, so after having your baby, what happens is your hormones go way down. They change really fast. Estrogen has a big drop. And that can obviously, I mean, every woman is different. Maybe one woman is easy, is able to sustain it better. Another woman, it's more of a crash that happens. If you have two women, one has adrenal fatigue, the other one doesn't, that's going to be a whole different situation as well. Or if their thyroid is off, we know that with having a child, your thyroid can get off, and you do need to have that adjusted after having your child. Your doses and all of that. So that can really affect the ADHD kind of presentation too. But what we know about estrogen is it increases dopamine levels. So it stimulates the enzyme, the tyrosine hydroxylase, which is the main step in dopamine production. So basically, more estrogen equals more dopamine in the brain. So if you have a crash of estrogen, you're going to be struggling because you're going to have a lack of dopamine, and then a lack of being able to, keep things together once you have your kid, like being able to feed at the proper times or be able to, keep the bottles clean when you need to, and just keeping all that orderly stuff, especially if that's the way that you used to be able to function, you notice a big difference in it. For some women who are used to that dysfunction, maybe they've already learned ways to hack that. So it might be harder maybe for someone who doesn't have ADHD potentially. Estrogen also enhances dopamine receptor sensitivity as well. So you talked about the estrogen, the dopamine sensitivity. And also like I said, when estrogen crashes, dopamine does. So you also see more so depression, emotional dysregulation. So feeling like a crazy person after you have your kid. You're like, why can't I just manage my mood? It's like everything sets me off. I'm on an emotional roller coaster. So yeah, estrogen is dopamine's best friend, and when that crashes, dopamine really crashes too. But there are strategies, and again, step number one is eat, because when a woman has a baby, she's focused on just feeding her baby. I see it all the time. Blood sugar goes crazy after having a child because you just don't eat enough. So that's, get a meal delivery, maybe have someone cook some food for you or have some food prepped before you have your child and put it in the freezer, because that will be probably the biggest piece to help you is food. And then there's other strategies from there.
Yeah, I can speak to that. I know that especially during the pandemic, I used to have, when my son was first born, I had my mom. She would come and visit and stay with us for a few months and was, just helpful with everything. And then around the time my son turned 1, we had a babysitter that would come work with us, a few days a week. And it was so incredibly helpful. But then the pandemic hit, and Colorado was very much, kind of and I think most of the world was at that time, was very much in shutdown world, and things got really bad for me at that time because I was like, "Oh my gosh, like, I can't go to the store, I can't get food, so I'm just gonna, like, intermittent fast," which you're not supposed to apparently do when you're breastfeeding, and then I would be filling up myself on, like, toddler snacks instead of, I'd be eating toddler leftovers instead of eating a proper meal, instead of eating a proper breakfast or lunch or dinner. And a lot of times I was like, it just, things got significantly worse for me. And I think a big root cause of that was the blood sugar swings, and was the, definitely combined with everything else that was going on, the stress. Now, I know that women who had been previously, maybe they had ADHD before, postpartum, you know, before perimenopause, they actually still can feel dysregulated, right? Where they're like, wait a minute, I had this under control. Maybe they were even on medications for it, but things can still crash and burn.
Exactly, and there might be a need for a dosage adjustment in medication. You know, people ask me, "Are you pro or anti-medication for ADHD?" And I just say, "A wise healer uses what works. You just use what's gonna work." And oftentimes the foundational pieces, the lifestyle things, make the biggest difference, but for some women, they just need some medication to help them as well. You know, Dr. Amen talks about it like putting on glasses. If you need a prescription, they can help you see the way that you need to see. So for some, it really is a game changer. I find that we're able to, with patients, do as low of a dose as possible because of all of the supportive care that can be done. Because there can be too much of an emphasis on medication sometimes. They just take the meds and all is solved. It's like that's not really the case because oftentimes with that you also don't eat because it can suppress your appetite. You know, so um, yeah, no, that's one of the biggest things I start with patients with is let's look at your blood sugar balance. What are your labs looking like? You know, let's track how you feel. Are you eating enough protein and getting their protein dialed in can be just the biggest thing. And I mean, it's amazing. A woman can deal with anxiety, eat some food, and she's good. It's like just that on its own help to calm the nervous system. And it signals to your body that you're safe because you're not going to be eating if you're running from a tiger. So even just eating sometimes can signal, oh, okay, I'm safe. I can start to, calm down because it's time to digest.
Oh my gosh, yeah, absolutely. And then skipping meals can be very stressful for the body if you're I'm a big proponent of like, yes, we don't have to eat every 3 seconds, of course. And we do want to sleep through the night. We don't want to be snacking at night, right? But when people start really limiting their eating, sometimes it's because of their dieting, sometimes it's because of stress. That does increase the stress that we feel in our bodies significantly more. I would love to kind of dig into the medical recommendation or the medication recommendations with you, as well as some of the non-medication things. I know for me, like I don't have an ADHD diagnosis, but some of the things that really helped me with focus were like thyroid hormones at one point in my journey. I utilized Vitex postpartum once I weaned my son. And that does have some, I know, mild dopaminergic activity, progesterone in perimenopause, addressing anemia, methylene blue neurofeedback. These are just some things that have personally helped me with my focus and getting my brain back on track. I would love to share, maybe give us a breakdown of the medications, pros and cons, and then in some of like the lifestyle strategies you had already mentioned, blood sugar balance, but also I know there are supplements that can be supportive as well.
Yeah, so there's a bunch of different medications and I don't prescribe them. They're out of my formulary. So typically what I do with patients is just help them to manage the medication in terms of side effects if they are going to stay on medication because you can have side effects with meds for sure. So what I find the best one that I usually have found for patients is Vyvanse. That tends to be the one that's the smoothest, doesn't have as many of the side effects. The one that I've seen that has had the most side effects for patients is Strattera, but some patients love Strattera. Some patients, that is the jam for them, and others, Vyvanse doesn't do it for them. So you just have to go into it with a clean slate and just see what's going to work. Obviously, Adderall, that's been around for decades. It's been around for a long, long time. But yeah, typically Vyvanse is the one that I've seen that's the smoothest. But there can be a drop off effect when you have it. When you take, typically you take it in the morning, and then once afternoon rolls around, oftentimes they just feel like they have a huge crash. And so how to prolong that is a big goal, that I work on with patients. And eating is another one because you don't eat oftentimes or drink water on these meds. So making sure you have a solid amount of protein, then taking your meds first. So having a meal first, then the meds. That right there can set you on a better foot. And then setting a reminder, having a solid lunch with protein. So I would say for women, have at least body weight. So if you take your body weight, divide it in two, then you want to have at least that in grams of protein a day. That's a bare minimum, but even up to a gram per pound of body weight, depending on the woman and how active you are. If you're, athlete or lift weights or whatever, it can depend on that. So those are the meds. So the typically the Vyvanse, like I said, I see the best results with that. There are some other ones, and then name brand versus generic matters. So some doctors will prescribe the generic of Vyvanse, and patients oftentimes say they don't feel as good on that, and they have to have the name brand. So that matters. In terms of holistic and natural support, I think of, kind of like a pyramid. So I'm always starting with the basics, nutrition piece. How's your nutrition? How's your blood sugar? And then I look at inflammation. So do you have potential causes of neural inflammation? That's going to worsen your ADHD. So are there infections? Are we seeing maybe Epstein-Barr virus? Are we seeing parasites? Are we seeing bacteria overgrowth? Maybe other viruses, maybe mold, because that's going to create, a dysfunction in the gut brain connection, and worsen that communication as well. So looking for other clues of inflammation, like do you have omega-3 deficiencies? Do you have a deficiency in these important fats that make the brain? Your brain is made of fat. So if you have poorer fats, your brain's not going to function well because you don't have that insulation, for that myelin sheath for your neurons for proper, signaling of your neurotransmitters. So looking for clues of neural inflammation, and there can be an autoimmune component for many patients with this. So we'll look at different, like I like the neural zoomer from Vibrant. We'll look at different autoimmune markers and see if it can be an autoimmune component with that as well. And then checking micronutrient deficiencies is key for these ladies. How's your B6? How are your other B vitamins? How's your methylation function? Are you activating, your B vitamins properly with methylation? How are your minerals? Zinc. Zinc is a huge one. Zinc and copper. How is your antioxidant function, like your glutathione levels, and selenium? I mean, I know selenium is key for thyroid function. So making sure you have the optimal level of micronutrients that's going to allow these neurotransmitters to fire, and to where you can make them on your own without needing the medication. And so those are all important pieces. And then one thing I've been leaning into more so with patients has been limbic system healing. That's So the limbic system is the portion of the brain that is kind of the trauma centers. So we think of like the amygdala, the hippocampus is part of that. So bringing in memory. So when you go through, oftentimes it's a perfect storm. Patients will say, like, I went through a stressful period of time. I got exposed to mold. I had a kid. I went through a breakup. A family member died. All these things at once. And then after that, I noticed I couldn't walk into a Home Depot anymore because the smell, I would feel sick. Or maybe I at that time became sensitive to light, or at that time, I just, everything I would eat I would react to. They just become this hypersensitive person, very much connected with histamine release. But we see this more so with the neurodivergent folks, because we tend to be more sensitive, more of a highly sensitive person. So, and then that's when you see someone who is highly sensitive to things that maybe someone else isn't, and they might label themselves as crazy. I mean, they might be the person in the house that they're reacting and nobody else is. And this is happening more so for women, because we tend to take on more, and hormones play a role and all that stuff. So I have seen some really cool improvements in ADHD symptoms by helping patients work on limbic system healing. And there's different methods to do that. There's different online programs, like I've had patients use DNRS. I've had patients use Primal Trust, Gupta. These are different, self-paced online programs that you can do. Sometimes it's a challenge to do it and be consistent with it. So that's why we have check-ins with them for accountability. But there's different exercises and visualizations and things, and just basically little by little, it's using the concept of neuroplasticity to rewire your brain. And that right there can help you make more dopamine on your own. So it's kind of like healing the tissue that makes these neurotransmitters, rather than forcing it to be released with meds. So I've been blown away by that. I mean, patients that just were so sensitive that now are able to handle things that they never could before, and not have that chronic overwhelm. Because like I said earlier, we know that cortisol shrinks the prefrontal cortex. So if you are in a chronic state of fight or flight, that's going to massively worsen your ADHD.
Yeah, that is fascinating. Thank you so much for sharing that. I know I've worked with neurofeedback a lot personally in my own body, and some practitioners also utilize that for ADHD and focus, and see major transformations where they're able to, work with their doctors to wean them off of medications, and they still function just as well, if not better, than they did with medications. And I feel like you said, a wise healer uses every tool in the toolbox. So that's really fascinating. I'm going to have to look into more deeper into limbic system rewiring, because I feel like our brain, neuroplasticity is such an exciting concept, and we can absolutely heal our brain and improve our brain if we find that there's something out of balance, right?
And it's never too late. It's never too late. You can rewire your brain at any age. You can. The more that it's all about repetition, repetition, repetition. So if you change your patterns, you can rewire. I mean, it's like putting new roadways in your brain and letting the old roads die. So, if you think of freeways, you can put new, beautiful roadways in your brain of rest, digest, beautiful dopamine production, all of that. And then you can have ones that are anxiety and negative thought patterns and hyperreactivity to stimuli around you. I mean, those things can slowly be, if you don't use it, you lose it. It's kind of like that with your brain. So, and it's really a beautiful thing. And sometimes I'll start with that first before I do anything. I've had patients where I say, I'm not going to do anything with you. Let's start with limbic system healing first, even just for a month. And then let's regroup and see where things go from there. Because if you're in a chronic state of fight or flight, you're not going to heal from anything, no matter what you're coming in for, because your body is just not in that mode. It's in survival.
Yeah, thank you so much for sharing that. That's such a great thing for people to be aware of. And not just with ADHD, but it could be used to heal a whole variety of different issues from my understanding, even like bowel syndrome, autoimmune conditions, multiple chemical sensitivities. I've seen people use that limbic system work for that.
Pain's a big one. Chronic pain, because these are where your pain centers are in the brain as well. So if you're someone who's always dealing with pain, I would look at limbic system.
Thank you so much. We'll have to link for those in the show notes. You mentioned mold, and I do a lot of organic acid testing and mycotoxins testing with my clients. And it's very fascinating because mold can really shut down like your dopamine production. It's very interesting that the organic acid test will show you if you're colonized with mold, and it'll also show you how your body is making processing different neurotransmitters. And oftentimes see those two things go hand in hand. And mold can really impact our histamine levels, right? So we can become overburdened with histamines. Like you can't really I don't really see that on the organic acid test, but I feel like whenever somebody has a mold issue, they're going to have a histamine issue. And histamine is also a neurotransmitter. It's not just something that makes us sneeze, right? Can we talk a little bit about the nuances of maybe histamine and ADHD, how important that is? How important is that connection?
Yeah, I mean that's why people take Benadryl to go to sleep, because histamine is it's an excitatory neurotransmitter. It's like the gas. So yes, when you have a heightened histamine, you're going to have a heightened nerve sensitivity. So you're going to oftentimes feel just more sensitive in general to emotional stimulus, physical stimulus. You're going to react more. It's an unfortunate thing because mold can create more of a histamine issue, but then when you have more of a histamine issue, you're even more sensitive to mold. Then you become that person that feels like you have to live in a bubble, and you just react everywhere you go. So, so histamine very much tied to. I find my ladies who have ADHD and also who have hypothyroidism, they're more sensitive to histamine. And when you have histamine, you feel a lot more anxious, a lot more anxious. Histamine anxiety feels like a kind of internal trembly feeling, like you just feel like this buzzy feeling. You just can't relax. You just can't. It's like you'll be tired, but you can't go to sleep. It's a wired but tired feeling with histamine. Um, and obviously that would make ADHD worse because you're already feeling like that kind of hyperactivity, right? So there's a big connection between histamine and thyroid and hormones. So we know like estrogen dominance raises histamine. Also common in EDS, so Ehlers-Danlos syndrome. I treat this a lot as well. Hypermobility um, as well. There's a big interplay with that. But when you have low thyroid function, it slows histamine breakdown. So that's oftentimes by getting the thyroid balanced out, the histamine can balance too. And then that can improve symptoms of ADHD. So there's, I mean, rabbit trails, right? Rabbit trails, you could go in a lot of different directions with this. But the main takeaway to just try to make it simple is histamine is an excitatory neurotransmitter, and it can stress the systems that are already out of balance with adrenal or thyroid dysfunction or with ADHD. And so then it can, just really make things a lot worse. So by focusing, and this is a big thing, and actually by the limbic system healing, that also calms histamine too. So by working on calming the histamine, whether it's things like quercetin or working on reducing histamine in your diet. Maybe there's a parasite, and that's why they have high histamine. So addressing the root cause of the histamine, usually their thyroid feels better, their ADHD symptoms feel better, their anxiety is better, and they're like, "Holy cow! This like I wish I had done this 10 years ago," but doctors don't know anything about it, so they usually don't have the help that they need until finally they come across something, usually on Instagram, and then they try low histamine and they're like, "Oh, I feel like human again."
Yeah, thank you so much for chatting through that. I know a lot of times histamine is something that people can really easily connect themselves to, and especially that feeling of trembling. And you're like, oh, yeah, and I have eczema, and I have asthma, and I have allergies, and I have acid reflux. And this is all kind of a presentation that can really mess with your focus as well. Now, I appreciate you talking about root causes of it. I have seen parasites be a big driver of histamine dysfunction. So blastocystis hominis, Dientamoeba fragilis, whole host of these different protozoa can actually upregulate our histamine production. And then, it's interesting when you look at this whole like neurochemistry and just the whole map of how different substances break down in the body. You talked about B6 and methylation, right? And so B6 and actually methylation, they can actually help with breaking down histamines properly too. And it's just kind of all related. So I appreciate that you're not like, okay, you have ADHD, go ahead and get your medications and buy, right? Because I think that's kind of the approach from a conventional medicine standpoint. What you're saying is, hey, you have ADHD. Here are some tools that can help you because we know what's driving this. We know the root causes. We know what's influencing this. And we can use medications as a tool, absolutely. But there's also these other tools that can either make the medications work significantly better, or and in some cases they can be a substitute for medication. As long as you're working with your doctor on getting off of it. I never recommend people like cold turkey or throwing their meds in the trash just because they're trying a low histamine diet or because they're trying a supplement. Like, make sure you're really working with somebody knowledgeable and in conjunction with your practitioner, right?
Right, right. And sometimes a patient needs some meds in order to do the treatment that's more holistic because it can be a lot to follow, right? So like having those little quick fixes that help you to be compliant and to follow through and having regular check-ins and accountability that can really set you up for success to do the bigger plan that then ultimately will help you to wean down on the meds or even off if that's the goal. But it doesn't always have to be the goal necessarily.
Yeah, I think the goal for me and I know for yourself too is like you want people to feel their best and use whatever tools they have at their disposal and educate about that. You want them to feel like themselves.
100%. Main word for me is freedom. I want these women to feel free. I want them to feel like they can really fully be themselves in this world that's not totally designed for their brains and also be able to function in the world in real time and in reality and be able to pay their bills and keep their house organized enough. It doesn't have to be like their friend next door who is this Susie homemaker, but enough to where they can function um, and be able to do the type of life that they really want to and use their gifts. Because I find that these ladies oftentimes are, I mean, no shade to someone who doesn't have ADHD, but the most gifted, the most creative, just dynamic, incredible women. And I want them to feel like I can function and I can fully be me and to not be so apologetic because there's so much shame that, we can be really hard on ourselves because we just feel like we haven't been able to match up. right? So just to feel free to be who you are and fully who you are, and also function in the world at the same time.
Yeah, I really appreciate that because, I feel like you said, when you don't fit into a box from a very early age and you hear all of these messages about yourself, it's really easy to internalize and feel a lot of shame about who you are and who you aren't. And there's so many beautiful things about you that you should be proud of and you should embrace. And yeah, maybe there are some things that aren't quite working for you right now, and there's a way to help that too.
100%. And people may not understand you, even if you explain it and try to educate them, and that's okay. You don't have to have everyone understand everything about you, but as long as you understand yourself and you give yourself that love and just stay in your lane and do the things that make you really happy and, dance and paint and make music and sing and do the things that, make you alive. I love this thing like follow the dopamine, the things that create dopamine release for you. Those are those are messages of what it is that is unique for you. So for me personally, I love singing, I love dancing, I love being creative. And if I weren't doing those things, I would feel like I'm shriveling and dying on this planet if I was trying to be like somebody else. So so setting that time and being unapologetic for following the dopamine for yourself. I just really encourage any woman. I don't know. I feel like someone needs to hear that to just go for it.
Yeah, thank you so much for sharing that. It's interesting. For me, one of the things that I found very much helpful for people with fatigue is to do more things that give them energy. And I feel it's like the same with whatever is out of balance in your life. Do those things that drive your dopamine, that drive excitement for you, right?
Yes. And that doesn't mean like doom scrolling through Instagram. That's the opposite.
Yeah, there are some things, like shopping that, always ups my dopamine, but that isn't necessarily the healthiest way to cope, right?
Yes. And ADHD ladies can be overspenders for sure because it can be the impulse. Oh, I really need this thing. And they're the ones that are getting all the Amazon packages. And then you receive it and you're like, oh, I forgot I ordered this. Like, oh, yeah, cool. It's like a surprise, like a dopamine release all over again.
Yeah, it's like, "Oh, wow, a surprise gift."
Uh huh.
I love that you mentioned, like, sometimes getting on medications, or, some dopamine supporting substances can help overcome that hurdle. Because I know sometimes when you don't have enough dopamine, and I'm speaking from experience, is you can have all the knowledge, you can have all of this, right, in front of you on what you need to do, but it's like the step from, like, knowing and doing just seems impossible, right? And sometimes just having a little bit of support there can help you do the things you need to do. Um, you also have some practical tips for us, for women with ADHD. I feel like any women could benefit from managing time, relationships, responsibility effectively.
Well, you talk about, like starting a task. That's called task initiation, and that's harder for ladies with ADHD. Like you could be laying on the couch and you know all the things you need to do, and you cannot get off the couch. You cannot start the task. So some of the little external things that can help with that. I love Mel Robbins. I think after she wrote the book, The 5 Second Rule, she learned that she had ADHD. I don't know if she knew it at the time, but I think that's why that worked for her, is because she gave it the 5 second rule: five, four, three, two, one, and you get up on the one because it's a deadline. So you're giving yourself a deadline to get up and to start that task. So, because once you start the task, typically it's a lot easier to do the thing. It's just starting it is so hard. And also, there can be overwhelm. Like, for example, taking a shower. For someone who doesn't have ADHD, it's like you just go take a shower. But for someone with ADHD, that is a task that has 10 different subtasks to it. I need to go get the towel. I need to undress. I need to turn on the water. I mean, all of it feels like a bunch of different steps. And so breaking these down into little sub steps and then checking them off can be very motivating. So yeah, so just realizing it's going to be different than somebody else necessarily. Having outside accountability is key. There's something called body doubling that is very helpful for those with ADHD. And all that is having someone who is there while you're doing a task. So, like my husband, we'll have a huge pile of laundry, and I'm like, hey, I'm going to do the folding. I want to do the folding, but I just can't seem to start. Can you just like hang in the room with me? And usually he'll end up helping me with the folding anyway. Or if you're cleaning the house, hop on a call and just put in your headphones and talk to someone, and you'll find you'll look back and the whole house is clean because they were there kind of like as an emotional anchor in a way, and helping you to stay on task. So body doubling is so helpful for ADHD folks. Um, and timers are key. Like for me, I have a lot of timers that pop up on my phone throughout the day. So I'll just say, hey Siri, remind me to do such and such, and it reminds me, and it's reliable, and it's amazing. Um, Going to sleep on time can be tough because you can get that second wind and feel inspired and feel like an inventor at night, and you want to save the world at night and all of that. So having a pop up that says turn your phone off in 30 minutes, and then when 30 minutes pops up, turn your phone off now. Having those little reminders, those little deadlines, those external helps are massively helpful. So those are little things that I think are great. And then also just letting people know in your life, like, this is something I learned about myself, and this is something I'm working on, I'm struggling with, or these are things that can help me. You don't have to do it alone. Just because maybe they don't have ADHD doesn't mean they don't want to help you. So having that conversation and opening up about it can be really helpful to have that support from people around you.
Yeah, thank you so much for sharing that. I feel like the body doubling can be a big game changer. I know for me, I wish I was like one of those people that got depressed when I didn't exercise. I'm just perfectly happy never exercising. And I hate every kind of exercise there is. Like there's not one I enjoy. So like I have to have a workout buddy. Like or I have to like trick myself in order to get exercise. And I also hate cleaning, so I have to trick myself to do that. And so I'll listen to, music or a podcast, an audiobook, or like just talk to somebody when I'm doing that. And that can make such a really, really big difference in getting the things that, you need to do to get done. And I love your other tips too. I think I'm going to start doing some timers. I think that's a really good idea.
Yeah. And little bite-sized chunks of time to do things, unless you're in hyper focus. So I think ADHD is shouldn't be named ADHD. I think it's more of uh, it's a issue with directing your focus. I don't think you have a deficiency in focus. It's about directing your focus, because those with ADHD have this amazing hyper focus superpower where you can go hours, days on something and just go deep into a topic, and it's a beautiful function of your brain. But you can also go hours and days without eating or drinking as a result of that. So, um, yeah, all that.
I find like the boring tasks are harder to do for a person with ADHD or focus issues, but the interesting things that drive our dopamine, that's where it's at. And it can be both a blessing and I'm sure a curse at sometimes when you have things that, oh man, like really boring things that you need to get done, but aren't getting done, right?
It's an interest-based learning system. That's what it is. And even though I'm a doctor, and like you said, I've had millions of downloads, I've treated thousands of patients, I failed some college classes because they were so freaking boring. I failed 4 college classes and I had to retake them and spend all that money because it was so boring. But then the ones that were really interesting, even if they were really hard, I would get like an A in that class. So, yeah, it's an interest-based learning system. And maybe the question really to ask yourself is, how can I make this fun? How can I make this fun? And because you're a creative, you'll find a fun way to make this fun. And then then you enjoy your day more, right? You have more dopamine release. You get to just feel like a kid. I mean, I feel like a lot of these folks, and I can say for myself, we're kids in an adult body, really.
I love that. That's a great way to stay young. And I know you are thriving and vibrant. Um, And I really appreciate you taking the time to talk about ADHD with us and all the things that we can do and helping to erase some of that stigma because like that diagnosis can any kind of mental health diagnosis can come with a stigma these days. Can we talk perhaps a little bit more about what we can do to reduce that stigma?
Well, this right here, just talking about it, spreading awareness is huge. A lot of ladies listening to this, there's going to be light bulbs that are going off and they're going, oh my gosh, I think I'm dealing with this. I really think this is something that I've struggled with that I had no idea about. So just talking about it because we're smart. We know our bodies. We just aren't given the right information and we're not able to make those connections just because we just don't know. And this is something you're not going to learn about in school. Your conventional doctor is not going to talk about it with you because they don't know about it. So learning about it is key and just spreading the word. I think that's probably number one, really. Yeah, educating yourself and just sharing about it to others. And more research is going to be coming out about it because research studies that are done on men. They're not done on women typically. So, but there is more research that's going to be coming out about women dealing with this because people are asking for it. And I think this is one great thing that social media does is massively spreads information. It may not always be accurate, but it is definitely spreading awareness about this big time.
Yeah, I really appreciate that in this day and age that we all have an ability to, connect outside of our circles because back in the day, maybe you tell your next door neighbor or your friend, from high school or something about the things that you're going through. But now with Instagram, Facebook, TikTok, and all of the social media platforms, we have the opportunity to share our experiences with others around the world. And that can reach so many more people who identify and whose lives can be completely changed through this. Dr. Lowe, I'm going to ask you a few quick questions, but before I do that, could you tell us where people can connect with you and get more information about you and your work?
I'm most active on Instagram. Usually I'll be really, really active for a few days or weeks and then I'll disappear for like a few days or a week and then I'll come back. So, but I am most, I would say, available there. If people want to connect with me, just ask a question. If you want to be a patient, best would be to reach out to us at Shine Natural Medicine. Our website, shinenaturalmedicine.com. You can learn more about how we work. We work with patients virtually. We're 100% virtual, so location isn't an issue and then the podcast, Dr. Low Show. So I've been doing that since 2011, and I'm about to release the next season. And now it's going to be video. So it's always been audio, and so this season we're going to be doing video and audio now. And you've been on the show a couple times. I'm going to have you back on, and every topic we've done topics on ADHD, on histamine, on hormones, on dental health, on men's health. I mean, lots of different topics, but definitely including these ones as well.
What do you take for histamine? Do you have any suggestions for histamine issues as far as I know you had mentioned quercetin and B6.
So love quercetin, love DAO enzymes. So you can have. I mean, there's a lot of foods that can trigger histamine issues. So chocolate can be a big one. Anything that is an aged food, so aged cheese, meats, fermented foods. So taking an enzyme, I like Hist-Dow from Zymogen. That one I like a lot. So I'll just take the teeny little microscopic tablets and what it does is it helps with histamine degradation in the digestive tract so you don't have that effect from that food. It doesn't reduce the body wide level of histamine, so it works a little bit differently, but quercetin can help with that. And then bromelain can be great. There's a medication called ketotifen. Sometimes I'll do that as a prescription from a pharmacy. LDN can be somewhat of a histamine stabilizer. So I love that for autoimmune as well. I think LDN helped me get pregnant, really, and I'm still on it. I think it's an amazing medicine. So those would be the main ones I would think of. And then, of course, getting to the root of it. I mean, if you have a parasite, quercetin is not going to do much, right? So you got to treat the root of the histamine intolerance as well.
Yeah, I remember I had hives, like horrific hives, and they were from the blastoparasite, which can lead to IBS and Hashimoto's and chronic hives. And then my aunt was like, "Here's some quercetin," and I was like, taking it, and I'm like, "This isn't doing anything." And I ended up taking Benadryl, which of course helped the hives, but also made me sleep. And then now getting rid of that protozoa, it's like I don't have hives anymore. Like I don't even have to think about that. Thank you so much for coming on to the show. It's been so fascinating to learn from you. And I am just incredibly grateful for all the information that you share. Before I let you go, I wanted to put you on the spot a little bit and ask you a couple of rapid fire questions. First one is if you had the supplement police come to your house and take all of your supplements, but you were able to just keep one, which one would you keep?
I would keep Gabatone from Apex. That's been my number one. I will use that always. I take 2 capsules a day and I will never not take it. My brain just loves it. It just works for me.
Now, GABA, that sounds like a calming supplement. Is that what it's for?
It is. And I love that it's not GABA on its own. There's no GABA in it. It gives you the building blocks to make GABA. And my brain just goes, thank you every time I take it. Thank you. It has a little bit of lithium orotate, and that helps to stabilize my brain in a really beautiful way. So that's my go-to.
Okay, great. Thank you so much for sharing that. I'm gonna have to look into that one. I haven't tried that before, but I'm excited to. Now, the other question is if there's any wellness hacks that you refuse to participate in.
I would say like cold plunges and intermittent fasting. I don't recommend that for women with hormone dysfunction or especially if you're like trying to get pregnant or if you're in perimenopause, if you have limbic system impairment, steer clear of that because it's just too stimulating.
Sister, I'm with you on the cold plunges. Like, I'm like, you can do a cold plunge if you modify it. And by modifying, I mean make it a hot bath. Like,
Exactly. Put some boiling water in there.
yeah, some bubbles, right? Like, that's the only way I'll get into a cold plunge is if it's like actually hot.
Exactly. Or marathons, just like extended cardio, all of that. It's just too depleting.
Yeah, I fully agree with you, especially for people with like adrenal fatigue, adrenal dysfunction, people that struggle with like fatigue and overwhelm already. Like, that's probably not the best for you. If you're somebody that's like super high cortisol and you have excess like nervous energy, maybe that might be a helpful tool. There's so many amazing tools out there. And I think part of it is knowing like what's the right medicine for you and what's the right dose and when do you time that medicine, right? Like, so perhaps if you are, my example was trying intermittent fasting when I was breastfeeding. Terrible, terrible experience, right? For somebody else, it might be a wonderful experience and it might be very, very helpful. And really appreciate you coming on. And then we got to get into some of the nuances to help educate people. I really love Instagram, but it's like we have to put out these 7-second videos or really short clips where people can't really get the full understanding of, is this therapy right for me? They might learn about a therapy and learn about some of its benefits, but that therapy might not be for them, right?
Yeah. Yeah, exactly. Yeah. No, it again, it's just love on yourself, ladies. Know that you are your it's N of one, right? So we look at studies, we look at the amount of people in a study. This is you on your own because you are your own individual. And and listen to things, try on some of this. It may fit, it may not. And there might be something in here that you hear that just changes your life and helps you to go more so into this journey of understanding yourself. So, yeah, hopefully that's something that this did for you guys today.
Yeah, beautifully said. Dr. Lauren, thank you so much for coming on and thank you for being here and all the incredible work that you're doing for women, helping them take charge of their own health and educating us all. And for everybody listening, I hope this has been a healing part of your journey. Until next time.